and they need our help now more than ever. This weekend, let's keep them at the top of our minds and avoid crowds, continue to wear our masks, and only gather with people in our household. Because these actions not only keep you safe, but they also keep our workers safe. And that's how we can celebrate and honor our workers this Labor Day, by continuing to flatten the curve and keep everyone safe. We are once again back on the path of recovery, which means reopening may be in sight. In fact, we are announcing today that hair salons and barbershops in LA County will be allowed to resume indoor operations at 25%. And our health officer, Dr. Mantu Davis, will go into these details further in a little bit. But we can easily be knocked off that path of recovery if we see another surge in cases after the holiday weekend, which was what happened after Memorial Day and the 4th of July. So please continue to do your part. Yesterday, the Board of Supervisors unanimously passed my motion to implement the Department of Public Health's plan to better protect Los Angeles County residents from the flu. As you know, we're once again approaching the flu season. But this year, there is a lot of uncertainty because the influenza season will occur during a global pandemic. Although the flu and COVID-19 are different viruses, and we don't yet know how they interact with one another, there are concerns that people can be infected with both, possibly exacerbating their symptoms. And the potential influx of patients with severe influenza could negatively impact our hospital system's capacity at a time when we need those precious beds the most. That's why getting vaccinated for the flu is more critical now than ever before. We don't have a vaccine for COVID-19, but we do have a flu vaccine. But we know that people are more reluctant now to visit pharmacies and doctors' offices where the flu vaccines are administered. That's why my motion calls for a robust, multilingual publicity campaign to encourage residents to get vaccinated. We must be creative and host flu vaccine clinics in hard-to-reach communities and launch pop-up drive-through vaccination sites in underserved communities. We must meet people where they are in order to do this work effectively and protect the public health. Additionally, flu vaccines are widely available through community clinics, local pharmacies, and primary care providers. The best way to receive a flu vaccine is to consult with your healthcare provider. If you're uninsured, you can call 211 or visit vaccinefinder.org to find a vaccination site free of cost. We're adapting to a life at home, and this can be challenging. It can be isolating, and it can also create tension and stress. Many people are feeling anxious and depressed right now. These are difficult times, and it's easy for us to feel overwhelmed. I've said this before, but I think it's worth repeating. It's so important to keep your connections right now, even though we are all at home. Call, email, text, and video chat with the people in your life. Try to reach out every day. It helps you as well as the people you are connecting with. No one has to be alone right now. If you feel overwhelmed or stressed and would like to speak to someone, you can call the Los Angeles County Department of Mental Health Access Center 24/7 helpline at 800-854-7771. We also have promotoras in the community through the Mental Health Promotores program. These individuals are trained by the Department of Mental Health, and their role is to provide free educational workshops to individuals and families seeking resources. The promotoras have been even more critical during the COVID-19 pandemic, given this crisis disproportionately impacts communities of color, which our promotoras serve. In the recent report, The Crisis of COVID-19 and the Southeast Los Angeles, the SALA Collaborative, Cal State LA Pat Brown Institute for Public Affairs and Latino Decisions found that only 15% of Southeast Los Angeles had been tested for COVID-19, despite the widespread availability of such testing in their community. This is in part due to the anxiety our communities feel about getting tested. Our Department of Mental Health and our Promotora partners can help with that anxiety, and I urge our communities to please reach out. However, I understand that there are many people who are not safe at home, and we want to help. For those of you who are experiencing abuse or the threat of violence in your home, safe and confidential help is available 24/7. Los Angeles County's domestic violence services remain available, and shelters are open and accepting intakes. Even when shelters are full, there is additional safe housing available through Project Safe Haven and other housing supports. Local agencies can help you access that housing. Services for those impacted by domestic violence include shelter, counseling, legal assistance, and many other services, including if you just need to talk to someone. Know that all providers are providing services in a safe way that complies with all public health guidance. If you do not have to have an experience physical violence to seek domestic violence services from a provider, we understand that domestic violence includes lots of different types of abuse and coercive conduct. And if you or a friend or a family member or someone who is feeling unsafe in their home, you can reach out to these services. They can help you find the right words to say to assist someone to safety. To be connected to domestic violence services that are available 24/7 and are confidential, please call the Domestic Violence Hotline at 1-800-978-3600. Enter your zip code and you will be connected to a domestic violence hotline. If you or someone you know is in danger of immediate harm, know that law enforcement is responding to domestic violence 911 calls and that emergency protective orders are being issued. The courts are open and domestic violence restraining orders are being issued. Legal services are available to assist you. And there are up-to-date resources on the Domestic Violence Council's website at publichealth.lacounty.gov/dvcouncil. Let's continue doing our part to protect and take care of one another, especially this holiday weekend. Thank you, and now I would like to introduce Dr. Mantu Davis.
Thank you, Supervisor Solis, and thank you to the entire Board of Supervisors. I am grateful for all you are doing to facilitate our county's recovery journey. Good afternoon, everyone, and thank you for joining us. Today, I'd like to talk to you about our current numbers, the latest updates we have on cases and deaths among people experiencing homelessness and staff working in shelters. I'd also like to update you on changes we're making to our health officer order in coordination with our Board of Supervisors and the state's updated reopening framework. First, on our status. We're sad to report we have 51 additional deaths today. 22 of these are people who died over the age of 80, and 17 people who passed away had underlying health conditions. 15% of these people who died are between the ages of 65 and 79, and 10 people who passed away had underlying health conditions. 8 of the people who died are between the ages of 50 and 64, and 6 of these people had underlying health conditions. 3 of the people who died are between the ages of 30 and 49, and 1 of these people had underlying health conditions. 2 of these people who died were between the ages of 18 and 29. Neither of these people had underlying health conditions. Information on the 1 death reported by the City of Long Beach is available at longbeach.gov. This unfortunately brings the total number of deaths to 5,878 in Los Angeles County. As usual, our thoughts and prayers continue to be with people across our communities who have lost loved ones and friends to this virus. 92% of the people who have died from COVID-19 had underlying health conditions. This again means that 8% of the people who died from COVID-19 were healthy or had no known underlying health condition. For the 5,535 people who have passed away where we know race and ethnicity, 51% are Latino, Latina, Latinx, 24% are white, 15% are Asian, 10% are black, less than 1% are Native Hawaiian or Pacific Islander, and 1% identified with another race or ethnicity. We're reporting 1,457 new cases today. This brings the total number of cases in Los Angeles County to 243,935. These cases include 10,674 cases reported by our partners in the city of Long Beach and 2,387 cases reported by the city of Pasadena, which have independent city health departments. 16,667 cases have been at some point hospitalized. 7% of all positive cases have been hospitalized in terms of our county. 1,048 confirmed cases are currently hospitalized. 31% of these confirmed cases are in the intensive care unit, and 17% are on ventilators. We've investigated a total of 1,660 residential congregate settings and non-residential settings with at least one confirmed case of COVID-19. Of these, 847 are being currently investigated, and 813 are closed investigations. Residential settings again include nursing homes, assisted living facilities, shelters, treatment centers, supported living, and correctional facilities. Non-residential settings include workplaces, food and retail, and educational settings. The total confirmed cases in institutional settings is 32,599, including both staff and residents. 16,517 of these confirmed cases are residents, and 16,082 are staff. We're sad to report that 2,632 residents in institutional settings have died from COVID-19. 2,377 of these people who died in institutional settings resided in skilled nursing facilities. Of 50 newly reported deaths today, excluding Long Beach and Pasadena, 12, or 24%, were associated with skilled nursing facilities. Again, our heartfelt sympathies are with all of you who have lost someone to COVID-19. We're reporting 3,570 confirmed cases at some point in jail facilities, 3,166 among people who are incarcerated, and 404 among staff. There are 244 cases in the state prison, 183 among people who are incarcerated, and 61 among staff. There are 758 cases in the federal prison facility, 742 among people who are incarcerated, and 16 among staff. And 143 cases in the juvenile facilities, 61 among youth and 82 among staff. Over 2.3 million people have been tested and had results reported in Los Angeles County, and our positivity rate for all of those cases remains at 10%. Our current last day, seven-day average positivity rate was 4.7%. Now I'd like to update you on people experiencing homelessness and the staff members across the county who work with this population. This population is among the most vulnerable in our communities, and I want to sincerely thank all of the organizations and staff who have been and continue working so hard to help protect people who are experiencing homelessness during this pandemic. At the outset of the pandemic, we had grave concerns about this population. They were unable to just stay at home as we advised everyone to do in March. They often live in encampments or in shelters that make it difficult to maintain physical distance. And they're at higher risk of poor health outcomes due to underlying health conditions. The data that we will discuss today shows that due in part to the partners that we've worked with or that have worked together to prevent and control outbreaks among this group of residents, these fears up to this point have not come to fruition. As of August 27th, 19,715 people experiencing homelessness have been tested, with 28,502 tests and 1.87% positivity rate among those tests. I want to again thank the work of the Department of Health Services and other partners for facilitating this testing. Now if we can go to the first slide. This slide shows confirmed cases among people experiencing homelessness and staff members at shelters. As of last week, there have been 1,589 cases among people experiencing homelessness and 160 cases among people who work at shelters. As you can see, in the month of August, there are two spikes in cases among people experiencing homelessness. That is the white line. There are a few explanations for this. First, there's been an increase in the surveillance testing and an increase in outbreak-related testing. Second, these reflect the date the case was reported, but some of the cases were diagnosed much earlier, and they show up later as data from our partners gets updated. If we can go to the next slide. This slide shows the number of people who are experiencing homelessness who have been isolated, meaning they were positive for COVID-19, and those who are quarantined, meaning they were exposed to someone who was positive for COVID-19. The lighter section of the bar is the number of people who were isolated due to illness, and the darker orange section of the bar is the number of people who were quarantined due to exposure to the virus. These numbers only reflect people who were referred for isolation or quarantine after initially being identified. It does not include people who went into isolation or quarantine later. Since March, 448 people who were experiencing homelessness have been referred for isolation, and 1,040 people have been referred for quarantine. As you can see, there were early spikes in April and May due to an outbreak at a large shelter and due to the wider testing in shelters. Since then, the number has remained fairly stable. If we can go to the next slide, please. Tragically, we've seen deaths among people who were experiencing homelessness as well as people who were working in shelters. As of this week, we're very sad to report that 41 people who were experiencing homelessness and 2 people who were working in shelters have passed away from COVID-19. As you can see, while these numbers are low, we do see that in the last month, 15 people passed away, which may be related to the spikes in cases we saw across the county in the month of July. For everyone who is grieving the passing of their friends or loved ones, we are so very sorry for your loss. Next slide, please. This slide shows cases and deaths among people experiencing homelessness by age. With the majority of cases are among people between the ages of 30 and 59, we see the mortality rate is highest among people the ages of 50 or older. Next slide. This slide shows cases and deaths among people experiencing homelessness by gender identity. As you can see, there are twice as many cases among men than all other groups, as men have a mortality rate that is nearly double that of women. This difference is likely a reflection of the fact that men make up a larger proportion of the homeless population in LA County than women and trans individuals. Next slide, please. Finally, this slide shows cases and deaths among people experiencing homelessness by race and ethnicity. Like we see overall in LA County, residents who are Latino, Latina, or Latinx, and Black have the highest numbers of cases and deaths from COVID-19, with 692 and 321 cases respectively, and 20 and 7 deaths respectively. And while the numbers are very small, people identifying with 2 or more races have the highest mortality rate, although this represents only 10 cases and 1 death. Now I'd like to update you on decisions made yesterday in consultation with our Board of Supervisors around Los Angeles County's recovery. First, beginning on Monday, September 14th, K-12 schools may offer in-school services for small cohorts of students with individualized education plans, students requiring instruction for English as a second language, or students needing assessments or specialized in-school services. As long as the school is able to fully implement the health officer's reopening protocol, this will get children who are in the most need of in-person learning back into the classrooms. We will not be opening the waiver program for instruction of students in grades TK through 6 as we monitor the implementation of this effort to safely get students needing specialized in-school services back at school. Second, after they've reviewed the updated order and the updated and required county protocols, hair salons and barbershops can reopen for indoor services at 25% occupancy, provided they are in full compliance with the health officer's protocols. If your hair salon or barbershop has been operating outdoors, please continue to do so and use your 25% occupancy for those services you are not able to provide outdoors. All other current restrictions remain unchanged at this time. Right now, a cautious and measured reopening with close monitoring of what happens to our data in the weeks that follow is needed to ensure we're not experiencing significant spikes in cases, hospitalizations, and deaths, as we saw in July after reopenings and holidays. As we slowly reopen sectors, we'll watch how closely how it is impacting our county transmission. Currently, the state has us at our 7-day average cases rate at 10 per 100,000. This is down from 13 per 100,000 that we were a few weeks ago. The longer our county's 7-day average case rate remains above 7, as determined by the state, the longer we will remain in the state's most restrictive tier. In addition, once both our 7-day average case rate and our 7-day average positivity percentage meet the criteria for Tier 2, they must stay there for at least 2 weeks before we can be moved to the next, less restrictive tier. I encourage all to follow the required county protocols and all personal protective actions. They are for the safety of our employees, our customers, and will help us to improve our case rates. Our department is here to help businesses understand how to comply. Continuing to slow the spread of the virus while reopening sectors is something all of us must focus in on. In closing, it's important for all of us to be diligent in doing our part to protect ourselves and each other from the spread of COVID-19. The virus is widespread in our community. The improvements we see do not mean victory, and it is still easy to transmit, and often people who are contagious don't have symptoms. This Labor Day, please all use the tools that we have to prevent and slow the spread. Wear a cloth face covering whenever you're out of your home and around others. Practice physical distancing of at least 6 feet or more than 3 steps away from others. Avoid crowds in confined places. Be flexible if you have plans outside of your home, and be willing to leave any space that becomes crowded. If you're planning to visit the beach, please know that they're likely to be crowded this weekend, and any crowded space, even if it's outdoors, can pose health and safety risks. Your best bet is to avoid crowds. Visit the beach at off hours, in the mornings or in the early evenings. Always stay physically distanced from anyone outside your party, and wear a face covering when out of the water. If the beaches get too crowded, it may be necessary to close them. In addition to being diligent in reducing the risk of transmission of COVID-19, if you are going to the beach, please bring a trash bag with you and take your trash home for disposal. Finally, please don't organize parties or start a bonfire on the beach. Fires in the sand are illegal and damage the beach and marine environment. They're difficult for beach maintenance staff to clean up and pose a safety risk to beachgoers. Please enjoy our beautiful county as safely as possible during this Labor Day weekend. And now I'll turn it over to Dr. Galley, who will give us updates from the Department of Health Services. Thank you.
Thanks, Dr. Davis. I'll touch just briefly today on testing and the hospital demand model, and then we'll turn it over for questions. So first, for testing, in anticipation of this upcoming holiday weekend, there will be a handful of the LA County operated and supported testing sites that will be closed in observance of the Labor Day holiday on Monday, September 7th. The details of the closures are all listed on the county website. As well, the state-operated testing sites will also be closed on Monday, September 7th, and the LA City-operated testing sites will be closed on both Sunday, September 6th, and Monday, September 7th, in observance of Labor Day. Again, all of the closures are available on the county website. The city's website also lists their specific closures. Individuals who need testing are encouraged to, again, first contact their healthcare provider or their healthcare plan. There are testing capacity that's available across provider and plan networks. It's also best just to discuss your specific situation with your healthcare provider so they can talk you through your symptoms, what your risk factors are, talk through whether or not you have a close contact and need testing. So that's a best first place to start if you have a healthcare provider. If you don't have a provider, you can obtain one by contacting the county's 211 system. LA County residents can, though, make an appointment also in addition to the county and city-operated testing sites through a number of other private sites that are located on the county's website. That includes a variety of retail pharmacies, private clinics, federally qualified health centers, as well as other entities. And I'm very grateful for all of the providers that have stepped up to enhance their testing capacity over the past several weeks and months. Shifting now to the hospital bed demand model. Last week, I shared that the number of new patients with COVID-19 that were requiring hospitalization was continuing to decrease across the county. This week, that continues to be true. The number of new patients with COVID-19 requiring hospitalization in either the county's public or privately operated hospitals continues to very slowly decrease, though the rate of decrease appears to be leveling off. Last week, we reported the R, or the transmission number, at 0.92. The value this week is 0.94. I'll remind you, anytime that R is less than 1, we can expect that the cases will gradually decrease over time. However, at 0.94, that number is still very, very close to 1. So that means if we don't continue doing those same basic core public health practices that we all know about and that Dr. Davis just walked through, physical distancing, wearing your mask when you're outside of your household, interacting only with those within your household and limiting your interaction and intermingling with those outside of your household, washing your hands, these and other things. If we don't continue to practice those basic public health measures, then we would very much expect to see those numbers climb back up. We are on the right track, though. The transmission has declined, and I think it should just provide reassurance for everyone that those practices do work and can continue to work. In observance of Labor Day, I also want to just extend my thanks to all the people that work, especially the workers on the front line. Whether you work in a healthcare setting, in a nursing home, a hospital, a clinic, whether you're in the social services industry, work for public utilities, farm workers, people who work in factories, manufacturing, retail, whatever is your job, I want to extend my thanks for your service to our community, your service to our society. It's your work that makes our society and our community function, and I am very grateful for your time and your energy and your effort that you have expended on a daily basis, on a weekly basis throughout this COVID pandemic. Please do enjoy the Labor Day holiday, but please do so safely. Please keep mind of those public health practices and stay safe so that in future holidays to come, we can all enjoy them together. We'll now turn it over to questions.
Ladies and gentlemen on the phone lines, if you'd like to queue up for a question, you may press 1 and then 0 at this time. Please limit your questions to one question and one follow-up only. One moment, please. We'll go to the first question line from David Rosenfeld from LA Daily News. Please go ahead.
Yeah, hi. Thank you very much for taking my question. I wanted to ask you about the process as far as easing this health officer order. You mentioned it was in conjunction with the Board of Supervisors. So was this done in closed session yesterday, or where did this take place, and why would this not be a public process where the businesses involved could chime in and let you know how they would be affected? And also, why not nails, massage parlors, tattoo, indoor malls, these other sectors that we've heard could open? Why are you choosing not to open those now, please? Thank you.
Well, I can discuss a small portion of it. You know, the Board of Supervisors goes over a lot of this information with our public health officer. And we do talk about what the process is in terms of outreach to the different sectors and especially to our resiliency task force, many of those members. So things are not just done in a vacuum. And by and large, the decisions are always based on data and scientific information that is given to us at the time. And we always, I think, have the best interest of trying to make sure that we contain the virus and that we try to bring that curve down that we've been talking about so that we can, I would say at a hopefully not too far off future, be able to open up all of our segments that are really hurting. We are very much aware of that. But I'll ask Dr. Davis if he wants to also give some background on that.
You know, I do want to really appreciate that question. I know it's something that everybody has looked at. What I will say that as a department, we have continued to do telebriefings and get feedback and hear from various sectors inside of the county in terms of what they'd like to see and feedback even on the protocols that are being implemented. The other thing that we have to do is every time we think about what to do next is to think about what does the state restrict us from doing. That's the first step, you know, what's possible. The other is to think about what are our data trends showing us? What have we learned from past experience with reopenings? And then we have to think about what is the risk related to the activities that aren't open still, and where can we have some reopening in lower risk locations, and at the same time, pay attention to the impact that that has on our data trends. I will say that as we look at this, the state has put us in a certain tier that does restrict a lot of what we can do. And within that, we have to try to manage as much as possible to, as quickly as possible, get more businesses and places reopened, but at the same time, not overwhelm the system so that we cannot get out of the most restrictive tier that we're in right now. So we continue to monitor the data as we do things. And I want people to understand that as we think about Los Angeles County, this is not a small place. When we talk about the sectors, there are thousands of businesses and thousands of people associated with those. And so we have to be mindful of that as we think about what gets reopened. But we're consciously thinking about how do we get our businesses back open, but we also have to monitor the data and use that to make our judgments and guide our discussions about what to do next. Next question.
Our next question comes from the line of Claudia Schuda with KNX News Radio. Please go ahead.
Hi, just a couple of quick questions and then a longer one. Is the resumption of indoor operations at barbershops and hair salons happening today, or is that also waiting until Monday? What is or will the county be doing to track the results of home COVID testing? And then based on the data that I've been provided by the coroner's office, homeless deaths are up almost 30% compared to the same period last year. Why do you think that is? Do you think there may be more COVID cases and deaths among homeless people than what's actually being reported? Thank you.
Okay, I'll turn it over to Dr. Davis on that. But as I said earlier too, though, we are looking at opening up our hair salons and barbershops, so at 25%. And I think we're going to go slow. And obviously, we want to make sure that everybody's adhering to that the health orders that have already been provided and guidance. And of course, our Department of Public Health will be available to help provide any more assistance and information so people can get ready.
Hi, Claudia. Thanks again for your questions. So hair salons, once the orders are posted and once shops have reviewed the protocols and understand what they need to do, they will be able to reopen today. As we think about the question of home COVID-19 testing, I think we're going to have to figure out what that means. If a person is able to do it on their own, is there a way to require, and how could we even monitor, whether or not a person actually was positive? Right now, the testing that's done right now is either done through our mobile testing sites. There are requirements for healthcare providers and labs to report those tests, but this is a new paradigm in terms of what we would need to do with home COVID testing. And so we'll have to look at that as that comes to fruition and think about how we might better get that information back to us to understand what's happening in our county. In terms of the homeless cases, we recognize that as we look at the data, sometimes it's difficult to identify whether a person was actually experiencing homelessness or not. We will be looking at, trying to slow down the data at the moment just in terms of being able to more accurately understand if a death that we do see was actually a person who was experiencing homelessness. So we'll probably change the reporting on that to allow for that time to more accurately reflect those numbers. The other thing we'll be doing is over the next month, or probably within the next month, doing an update on our deaths related to homelessness, and hopefully that will give some more answers to the questions as to what may be happening there. But in general, it's just a question of identifying that a person who actually passed away was actually experiencing homelessness. Thank you. Next question.
Next question will come from the line of Carla Hall with Los Angeles Times. Please go ahead.
Thanks, Dr. Davis. I have a question. How many of the homeless cases of COVID were actually in shelters? And also, I think related to Claudia's question, I think the question is, do you have any sense of whether those deaths that have already been reported by the coroner's office could possibly be COVID related? That's it.
Thank you. I appreciate that. I'll have to get back to you related to the homeless cases in shelters. I don't have them off the top of my head, and so I want to make sure I give you an accurate number. In terms of whether or not the deaths from the coroner, we know that those are related to COVID-19. Assessing a death does take some time to do. It requires looking at all of the changes that may have happened in the deceased body to understand what may have been the true cause of death and what may have contributed to it. So in general, our coroner and his staff are working very hard to make sure that this is clearly identified. and we continue to work with them in terms of looking at that information. But that's generally, it takes some time to figure that out, and oftentimes there are other factors that were associated with that as well. So we have time for one more question.
We'll go to the line of Angie Crouch with KNBC. Please go ahead.
Yes, as we're moving into the Labor Day weekend, I couldn't help but notice on yesterday's press release from county officials, they had a list of prohibited activities, which we hadn't heard spelled out as specifically in the past. Things like backyard barbecues, dinner with extended family, even gathering with friends at the beach. And I'm curious about whether or not this more specific messaging is because we're moving into the Labor Day weekend and these are activities that are continuing to cause the spread of COVID. Can you address the messaging of these particular banned activities? Things like baby showers, gender reveal parties, and barbecues.
Thank you for the question. I will say that gatherings are prohibited. Really, the only folks that should be gathering together are members of the same household. We know that as the holidays come up, this is traditionally what people will do is they'll get together, and all of it could increase the risk of transmission related to COVID-19. So it was really an intent to be more specific as we understand what we all typically do when a holiday comes around. But those activities are the same activities that were prohibited before. We just spelled them out just as people think about what they may do this weekend. But again, we want people to enjoy the Labor Day weekend, but to do it in a way that doesn't potentially increase the risk of transmission for them or anybody else around them. So thank you again for that question. Now we'll turn it over to remarks in Spanish.
Buenas tardes y gracias por estar hoy día con nosotros. El día de trabajo se acerca este fin de semana y como todos saben, va a ser muy diferente este año. Es obvio que nuestros trabajadores mantienen nuestra sociedad en marcha y ahora necesitan nuestra ayuda más que nunca. Este fin de semana toma en cuenta que tenemos que seguir usando tapabocas y estar solo con personas de nuestra casa, porque esto no solo le va a proteger a usted, sino que también va a proteger a nuestros trabajadores esenciales. Y así es como podremos celebrar y